So today I'm going to talk about Jenny Ruhl. She wrote this book, Blood Sugar 101, What They Don't Tell You About Diabetes. I've done another video on this book specifically. I've read the book from cover to cover, learned a huge amount from it, and have reread a lot of sections. This is a new book, so I haven't gotten it marked up yet, or I probably won't. I don't need to. I've got another book, can't find it right now. It's the one I've read, and it's marked up a lot. Now, Jenny's not a physician. She's a patient. And her patient experience is very interesting. 20 years after her formal diagnosis of diabetes, she's got no eye disease, no kidney disease, no heart disease. How did she do it? Tight control. We'll talk about that in just a minute. But first, a brief introduction for myself. My name is Ford Brewer, F-O-R-D, Brewer, B-R-E-W-E-R, and this is the Prevention Channel. I started off as an ER doc. I interned at Charity Hospital in 1981. So yes, I'm maybe older than I look. Working in an ER a couple of years later made me very interested in prevention. People come in and they shouldn't be having the heart attacks they're having so early. They shouldn't be dying as early as they do. Most of the things we suffer from as human beings are preventable. So that's my focus. I went to Hopkins to learn prevention, ended up running the program in postgraduate medicine for preventive medicine at Johns Hopkins, and have been helping docs, mostly primary care docs, learn how to do prevention ever since. And that's involved managing medical staffs of hundreds of docs. So you can always learn. And again, a huge portion of what I've learned from patients. This is a patient that I've learned a lot from. She's not my patient, but again, she's someone else's. She's run into a lot of problems with her docs, so she's one of these self-care patients with getting some assistance from the docs. This is Jenny, and I'm going to cover a couple of things about her patient experience, as I said earlier, because it's very interesting. She's 69 years old. She was diagnosed with type 2 20 years ago, 1988. Several years ago, she discovered she actually had MODY, maturity onset diabetes of youth. That's not type 1. It's not type 2, but it's a genetic type of diabetes that happens as you get older. So she was diagnosed, about 48 years old. After a diagnosis in 88, she ate a very low carb diet for 7 years and controlled her blood sugar. Then she decided to start using fast-acting insulin at the meal to manage her blood sugar. She then switched to Prandin, or repaglamide, or repaglinide, however you pronounce that, or you choose to. She switched to that for a time period, a year, because it turned out to be the best drug for MODY when she was diagnosed with it. Here's one of the most interesting parts of her experience as a patient, even more interesting than the MODY, and more interesting than the fact that she's been able to control her or prevent cardiovascular, kidney, eye disease. I'm going to read it. Then, for reasons no one can explain, my blood sugar control improved very suddenly about 5 years ago. That's 2013. So I currently control my diabetes with diet alone, though I will occasionally take a very low dose of Prandin if I'm going to eat a high-carb meal. My A1C as of March 2018 was 5.7%. Again, 20 years after her diagnosis, an A1C of 5.7, and practically, for the most part, off medications again. So that actually makes a significant comment about MODY, and I think it does actually filter over into mechanisms around type 2 diabetes. You tend to see fluctuations in your body's ability to manage carbs. So you need to be watching that, and you need to respond accordingly. Now, I currently weigh 150 pounds. After losing 30 pounds with a ketogenic diet, I switched to a 5-2 fasting diet. The 5-2 fasting diet is the only diet I've ever had that left me weighing more than I did when I started. So I'm not doing that again. What else? Oh, so now she gets into why she created her website. For her, she did weight loss and fitness, got to a fit level, although she said that was a challenge. She said it didn't help at all. So I started researching on the internet, and I found that the stuff, and she was looking at studies. So you can tell by reading her book 101. She goes fairly deep into the science as well. That's why I see her as a kindred soul. The information that she found was significantly different from what her docs were telling her. And, well, if you've watched a few of my videos, you can understand that. There are a lot of places where I wouldn't agree with the standards of medicine. In fact, she says the current standards are inadequate. And if you've been watching my videos recently, I've done a whole series of videos on how the current standards for A1C goals are inadequate. They're based on information, the UKPDY prospective study, the Accord study, the advanced study, all of which are listed and referred to in the ADA guidelines, which say 7 is the best goal for A1C. Because when you drop it lower than 7, you tend to get problems with death, cardiovascular disease. What they have failed to recognize, and this is where, again, I'm very, I see Jenny Ruhl as a very kindred soul. What our standards bodies, the ADA and most docs, have failed to recognize that these studies, Accord and advanced studies, the studies that these guidelines are based on, did not manage lifestyle. They didn't even manage, again, half, sometimes, 3/4, half the people were actually taking baby aspirin. Their blood pressure wasn't being managed. As many of us know, 10% of diabetics are actually being managed to the current very weak standards. So, pardon me if that started to sound like a rant and a diatribe. She then goes on to explain her book, Blood Sugar 101, which is basically a compendium of what you see on the website, Blood Sugar 101. I believe that is it. It is. Thank you for your interest, and we'll cover, I think, her website a little bit later.